Hello and welcome to Reach Live. It is always a pleasure. Hello and welcome to everyone that's tuning in live on YouTube and on LinkedIn. Very warm welcome to you today. It's always a pleasure on the last Friday of every month to be hosting Reach Live. My name is Reena Sangar. I'm the head of digital and connected health at Ipsos. Ipsos are a global market research and insight agency, and one of the joys of the job that I do is I get to talk to fantastic people from around the world who are making considerable differences in healthcare. Please introduce yourself.
Hi, how are you? Thanks so much for having me. My name is Dr. Rob Lewis. I'm the chief of neurosurgery at Hoag Hospital in Newport Beach. And what I do is I specialize in combining minimally invasive techniques and advanced technologies in order to make brain surgery safer and less invasive, and ultimately with the goal of better outcomes for patients.
Thank you. So Rob, there's a lot to get through, but to start with, we can't assume that everyone knows definitions when it comes to the world of digital health. There are so many technologies and applications for them. So I'd love to open with some definitions so everyone's aligned on what we're talking about today. So virtual reality, how would you define it?
So virtual reality is a technology where a person can be completely immersed in a computer simulated world, and that world is meant to replicate their physical presence in another space. For example, in outer space or in an airplane or during surgery. So it's completely computer simulated and immersive, and therefore meant to make it feel like they're in that particular environment.
And you require a headset to have
Yes.
the virtual experience for virtual reality, right?
Yeah, this requires a headset, and essentially the headsets are immersive, and so they kind of block out your field of view, so that you're not able to see much of the real world. And then typically, when you're inside the headset, you're able to look around and realize that the digital world that you're in, is circumferential. It's 360 degrees around you.
And how about augmented reality?
So augmented reality is taking somewhat similar computer-generated images or graphics or information and then adding it into our ability to visualize the real world. So for example, the simplest example of augmented reality is in our car, when the navigation display is projected into your field of view as a heads-up display, that's considered augmented reality.
And that can be done through various technology forms, right? So the smartphone window or,
Yep.
Headsets and things that also exist.
Yeah, any portal that can allow you to see the natural world and then have additional digital information added on top of it will allow for augmented reality. So whether it's a surgical microscope or where it's a pair of Google glasses or where it's a phone, any of those would be considered as augmented reality.
And then XR, mixed reality.
So those also are two different things. XR, extended reality, is kind of a catch-all phrase which includes virtual reality, augmented reality, and mixed reality. And finally, mixed reality is a bit of a newer term, essentially that combines the features of augmented reality with the ability for those features to then interact back with the user. So I use a simple example. In an augmented reality world, if there were to be a digital Coke can sitting on the counter, I would walk over to it and I would see it, even though it's not physically real, but I couldn't do anything with it. If it was mixed reality, I would walk over and knock that Coke can off of the counter and it would fall on the floor and spill all over the floor. And so there would be a reaction. So there's an interaction between the user or the person and the digital or augmented component. And that's what qualifies as mixed reality.
Interesting. I think I actually learned another level of that today. So thank you.
Absolutely.
We have a bumper attendee list today, and I can see, so many people have joined, and thank you for that. And I'm sure there's a mixture of people who are aware of it or not. I just want to say a big shout out to the International Virtual Reality Healthcare Association. in particular Bob Fine. Thank you so much for all of those that are attending from that group. Now, today is about you and your journey. Thank you for setting out the landscape. But I'm really interested in how did you become interested in this world? So please tell me what happened.
Yeah, so before I became a neurosurgeon, I was a neuroanatomist, and so my kind of primary interest was in studying the three-dimensional relationships of different structures within the brain. And then when I actually became a neurosurgeon, I was somewhat disappointed at the availability of technologies in order to do this. Surgeons, up until very recently, have always been forced to look at our images, the MRIs and CT scans, through the eyes of a radiologist, because we're given these kind of cross sections, these two-dimensional images, which then we are required to reconstruct in our mind in order to make a 3D model. This is something that we're actually pretty intrinsically bad at, to try to interpolate the data and make a 3D model. So when I first started, had an encounter with virtual reality was in 2015 with a company called Surgical Theater. And what they did, there were two engineers and fighter pilots from the Israeli Defense Force who were working on the flight simulator technology for the F-16 fighter pilots in Israel. And so one of the co-founders was sitting over a cup of coffee on in Starbucks, and kind of he was talking about the project, and then somebody next to him leaned over and said, "Hey, can you do that for brain surgery?" And that was Dr. Warren Selman, and he was the chair of the board of neurosurgery at the time. And so they started talking about how. So what Surgical Theater did was take a technology which was meant for war, which was meant for making fighter jets and simulating with them, and convert it into a technology which allows surgeons now to simulate and rehearse and plan for, and now even prepare for brain surgery in a patient-specific manner. So it allows us to have these patient-specific precision models, which we're able to fly through and practice the operation before we ever get there in the operating room.
This is fantastic. How was it the first time that you got to experience it? How tell me about it.
It was kind of mind-blowing. Again, every day as a surgeon, we have some representative of another company kind of knocking on our door. Oh, you have to try this new technology and that new technology. And they're all kind of small changes. Or the microscope light on this one is 20% bigger than the other one was. And then when I saw this, it immediately, like a light bulb went off in my head. I said, wow, this is totally different than the way we do it now. Because, rather than trying to imagine what this patient's, anatomy and tumor and pathology are going to look like, I'm given a very specific model that I can manipulate, that I can try 2 or 3 different plans. And so I can make sure I can get the operation right when I do it on the actual patient.
So how is the utility of it? I'm just really intrigued by this right now. Is it something that's kind of seldomly used for very complex surgeries, or is it very much in the training piece, or is it actually becoming a standard?
No, it's used increasingly more and more. I mean, I use it on every brain tumor, skull-based tumor, or pituitary tumor that I do, and it is becoming increasingly widely adopted across the nation now, with numerous institutions having adopted this technology. New York Presbyterian, Mount Sinai, Stanford, the Mayo Clinic, just to name a few. And so as time goes by, people are kind of catching on that this is just a better way to do things as far as preparing and planning for brain surgery. Now, one of the things we kind of stumbled upon during this process is, I was telling patients that, okay, I'm using this VR technology, which allows me to simulate the surgery beforehand. And in some cases, it allows me to change the surgical plan beforehand. So after doing the VR, have been several cases where I realized that, my original plan wasn't going to work. I wasn't going to get the kind of line of sight that I needed to get to the tumor. And so the VR simulation allowed me to change the plan prior to surgery and ended up performing the right plan on the patients. But this process of kind of explaining this to patients of how I do this and how I prepare it started triggering a couple of the patients. Hey, listen, I'd like to see that. It's my brain. So, am I able to see it? And so we had this light bulb moment of like, wait a minute, this technology can really also be powerful to help patients to better understand their condition and including be more and more prepared for the upcoming surgery, which we have planned. Obviously, this is a really scary time going into surgery. And so anything we can do to alleviate their fears. And in this particular technology, what it does is it doesn't take away the fear of the operation itself, but it takes away the fear of the unknown, that they don't understand what they're going to be going into. And that's really been critical for improving our patient-reported outcomes.
Oh, I can imagine. I can imagine. I mean, it's a game changer, right? To suddenly feel
Absolutely.
like that collaborative care model, right? I'm involved, I'm able to see it. And, I can imagine the patients just feeling so much more, empowered as well to have that knowledge. Let's talk about applications, and because I think virtual reality is starting to see its role to be played in very niche spaces, and I know that you're very much involved in different parts of that. And in our previous discussion, you've really spoken about it in a nice way of these different stages, depending on what the intervention is. So break it down for us a little bit more. Where is the opportunity for virtual reality and augmented reality or mixed?
Because we had so much success deploying the virtual reality in the surgical simulation and patient planning and surgical planning piece, the patients loved it so much. We understood that this is a technology that might be more broadly applicable to enhance the patient experience. But what I started to do is dig a little bit more into the research and the supporting research behind not just advanced visualization technologies for simulation and preparation for surgery, but also into immersive therapeutics. So virtual reality and augmented reality technologies, which actually have a therapeutic benefit by way of the content that's included in that. So, over the next few years, I really started to dig into the space and work with many of the industry leaders, including people like Walter Greenleaf and Bob Fine from the International VR and Healthcare Association, and kind of progressively over time develop this model of how to look at where these different technologies stand in the spectrum. And so I kind of built this structure. We have a little graphic that I kind of use to help explain it. But the idea is that all of these technologies are going to enhance the patient experience, that because of their immersive nature, whether you're walking them through their plan for surgery or putting them on a beautiful beach so they can just have a moment of mindfulness, all of them enhance our ability to improve the patient experience. But beyond that, I started digging into where does the evidence stand? It was supporting some of these technologies, not for patient experience, but for actual therapeutic benefit. And so based on what I found, I kind of developed this 3-tier strategy of how to look at these different technologies. So number one is the first category is deploy. This is technologies or softwares or systems which I believe have sufficient scientific evidence to just put them into practice. Let me give a couple of examples of that. Acute and chronic pain. There are more than 500 published peer-reviewed articles for the use of virtual reality treatment in the setting of acute and chronic pain. So, and yet this is not something that's covered by or paid for by this CMS, by Medicare or by commercial payers. So we have a technology which is supported by more than 500 published trials, and yet it's not yet widely available because it's not paid for by insurance. However, if you think about the potential upside of this, we now have 50,000 Americans dying every year from opioid overdose. And there's a technology which, at least in part, can contribute to a decrease in the need for opiates, a decrease in people's pain, and therefore having fewer and fewer people become likely to, or actually becoming dependent on these dangerous medications. So I put virtual reality treatments for pain in the deploy category. Yes, we're still studying it, but there's enough evidence that we should just be offering it to our patients. And in fact, at Hoag Hospital, that's what we did last year. Even during the time of COVID, we were able to deploy VR headsets to more than 1,000 inpatients during the hospitalization, including those with COVID, in order to be able to deliver pain relief, anxiety relief to these patients who are not only sick, but now because of the pandemic, isolated in the hospital. So that has really been a successful effort. Other things that I put in the deploy category would be things like post-traumatic stress syndrome or phobias. You know, the standard of care for phobias is close your eyes and imagine you're in a high place. That's not really that effective as compared to putting on a VR headset and then having each day be, we bring the elevator up one more floor and you get a little used to it. So this kind of progressive, controlled exposure and therefore desensitization is really one of the things that's powerful in VR. Another thing it's really good for is learning. So we have this kind of cognitive bottleneck in learning where if you're learning something on a paper in a traditional format, your brain is only able to absorb so much of the information, and so it happens slowly. In virtual reality, because you're immersed in the environment, it's able to unlock all four of the brain's learning systems. So the cognitive system, like we talked about, the experiential system, because you're immersed in it, the behavioral system, because it feels motivating to you, and the sensory system. So you're actually feeling and experiencing what it is to be there in that environment. So it really does unlock a key to more advanced learning. Beyond the deploy category, there are other technologies which are out there but require more research in order to kind of get them ready for quote prime time. So we're working actively with many of the companies to help prove out the use case. And then finally, we put in the outer sphere develop. So there are many technologies and many clinical problems which our clinicians have, which we are listening to them and saying, okay, is this something we could build a solution around in order to address an unmet need? And this is what we've done in partnership between Hoag and Behavior in order to create Behavior, which is our product for maternal mental health.
Oh, that's just so much rich content in a short space of time. So well done. You went through a lot of examples there, which are very powerful. So deploy, we know they work. Let's get moving. Let's really advocate to get them out there. Research, we're starting to see the benefits of it, and we're generating more evidence. And develop where there's our unmet needs and that we can really grow. But you talked about maternal health, and that's something that's extremely important to Reach and the initiatives that Reach run, as with the Save Mums campaign and such things. And I know you've been involved with Nurture VR too, right? So talk to us a little bit about that and that initiative.
Yeah, so this was a great project. What we started off, I have a passion for mental health. I'm a neurosurgeon, but we all have family members and friends and colleagues who've been afflicted by different mental health conditions, from schizophrenia to addiction, and even now coming out of the pandemic, I think it's even worse because many people have been subject to isolation. In addition, the disparities of availability of care. I mean, even in wealthy communities, there's not sufficient access to care for these things. And of course, across other communities of different socioeconomic classes and different ethnic and racial backgrounds, there just isn't access to care for mental health. And there's this stigma around it, like, that these people are choosing to be crazy, or they're choosing to, become, dependent on something. And that's just not what the science shows. I mean, these are medical conditions. And so we have to really rethink the way that we address them. But these disparities exist. And so Wenqi Chen, who's the chair of the board of HTC, said it very eloquently, and I'm just going to steal his quote for this. And what he said is, we don't have the human resources to address the mental health crisis, and particularly the inequities across different socioeconomic classes in this country. We just simply do not have enough physicians. We do not have enough nurses. And so with digital health, with digital therapeutics, and that's what Nurture VR is, what we decided was we wanted to create a digital platform, which is for a relatively low cost, available in order to provide much of that same level of care. It's kind of a front line, a first line for people to have access to information and mindfulness sessions and other tools which can help them prepare for pregnancy. One of the things that many people don't know is up to 20% of women suffer from peripartum mood and anxiety disorders, what we call PMAD. And this is something that was brought to our attention by Dr. Allison Brooks, who runs the Women's Institute at Hoag Hospital. And basically she said, what we need to do is start earlier during pregnancy, teaching new moms that, yes, this is an exciting time, but it's also a stressful time. It's also a time when your body is changing. It's also a time when, your relationship with your partner may be changing. And you're just told by society, you're supposed to be happy. You're just supposed to be thrilled. And in many women's experience, that may be true one day and then the next day not. And so it's really a difficult thing. And then after the baby is born, you have this kind of rush of change of hormones. And it really does affect many women that they become anxious or depressed, and they're having a hard time connecting with their baby. And so particularly in this situation, because it's so prevalent, and in some socioeconomic classes in some areas of the country, there's really no access to this or even awareness, around this condition. So there's no resources for these new moms to be able to hey, I need help. Yes, I love my baby, but I'm really stressed out and I'm having a hard time coping with all the changes. And so we build Nurture VR with 20 weeks of content starting at week 28 and meant to continue into postpartum week 8, with the idea that, number one, it can really help to build in this kind of resiliency and build in the skills of mindfulness and teach some of the lessons that can help keep moms in a good space. And some days when they're not, that's okay too. But the idea is progressively over time to support them. Now, the advantage is that not everyone has a one-on-one coach that can be with them on demand every day to kind of help coach them through this. And this digital therapeutic that Nurture VR has been built is meant to solve those problems. And the idea is that it doesn't just solve problems for, one particular group or one particular, socioeconomic class. It's really designed as a digital therapeutic to help us bridge the gap and provide those same level of education, the same level of resources, those same kind of mindfulness training to really work towards wellness. Because, if you kind of take a family-centric model, this is the beginning of the family. This is the beginning of life. And so getting the mom and the baby off on a good foot by teaching about mindfulness and meditation, by ultimately lowering levels of the stress hormone cortisol, we can impact in the long term both the development of the baby and the relationship with the mother as they grow to build a stronger family.
Compelling stuff. I trained as a cognitive behavioral therapist before pivoting my career into research, and all of this stuff just rings so true. I remember the big long wait times and the big waiting list we had in mental health services. Wouldn't it be fantastic that we could roll out this resource for those individuals? And also, knowledge is power, and sitting in a room and just imparting things around mindfulness and breathing techniques and other kind of stepwise ways that you can challenge your thinking to impact your behavior. I just kept thinking, wouldn't it be wonderful if we can scale this? And that's what you're speaking about. And it's just, I just hope we can get there. I really do.
We can.
I want to talk about, I believe so. And with the attendance levels today, I think a lot of people believe so. I do, conscious of time, I do want to talk about scaling, because there are challenges here, right? We've talked about some fascinating examples, but we have a challenge, and not just a payment challenge, and there is an access challenge too. So what would you say to people that say, well, VR is great, but we can't scale it? what's your challenge to that question?
Yeah, I say I completely disagree with that. And that may have been true several years ago, or even a few years ago, when the VR headsets required to be plugged into, a very expensive computer with a high level, gaming processing unit in order to run it. We now have commercially available Oculus Go or Oculus Quest headsets, which are, kind of $250 off the shelf. They come and you put it on, and the user experience is very easy. You kind of log in, you've got a little pointer, and you click where you're going, it's relatively easy to navigate. And these are available now for somewhere around $300, which isn't cheap, but when you consider the average person spending around $1,000 for a new iPhone every couple of years, and that the potential therapeutic benefits that this can offer, it's really something that I think now both the quality and the cost of the commercially available headsets are ready for prime time, which will allow for large scale adoption. And we've seen this in our hospital system as well. As I said, we're able to deploy this in the course of 6 months to more than 1,000 patients in the inpatient units. And now with Nurture VR rapidly expanding the availability of this program, which is meant to be delivered at home.
And I mean, there's quite a variation as well in the marketplace, right? We talk about consumer products and accessible products, but there's also a lot of work being done more B2B, like business to business enterprise level, more high-end devices. I mean, HP Inc., for instance, have their kind of headsets and things. So do you think that is also going to help, basically, that we've got both ends of the market?
100%, because there are different use cases for different types of headsets. For things like Nurture VR, where it's meant to be done at home, where it's progressive, where the content is beautiful and meditative and educational, but it doesn't require a massive amount of sophistication of data coming in. If you take that as compared to some of the, for example, surgical simulation applications where there's an enormous volume of data that's required to recreate the MRI of this patient. Those are systems that are still hooked up to a fairly expensive computer system. But as time goes by, I mean, the cost of the standalone headsets, which is for most cases, that's what we're talking about using. And when I say standalone, I mean a headset that doesn't require a computer. It's just by itself, you plug it on and it's ready to go. Those are widely commercial available in the approximately $300 range. So if we talk about other things, other applications which can help with digital health, things like a phone with apps to track your diet or to track certain behaviors, or a Fitbit or iWatch, which is $200-300 or more dollars, which is tracking your steps. In this case, this is a tool that again is a frontline digital therapeutic. So if you're talking about, for example, someone with addiction and they are struggling in the nighttime with the relapse, if they can just get to the point of putting on the headset, it might be that particular session is able to get them through that 20 minutes or 30 minutes of craving. And so really kind of keep them in line, because again, the problem of access, there isn't in the middle of the night physicians or therapists standing by waiting to be able to help those in need. And so again, this idea that the digital therapeutics, that virtual reality, augmented reality can serve as a front line and a resource to our patients that are out there. And again, particularly in the lower socioeconomic communities where, the access to even their own physicians may take 3 months or 6 months.
Rob, there's so many more questions that we have, but we are out of time. And so, yeah, I mean, honestly, I hope we can come back again and have more of a conversation, because it just feels like we're at the beginning of the tip of the iceberg. But yeah, I think you've said some fantastic things today. And just for me to kind of just react back to the audience and just think really through, we can clearly see benefit states here, that deploy message that you're giving, to be able to simulate an environment and kind of stage it bit by bit. It's just a fascinating thing, and there's so much more that we can learn here. I do want to give you the final word in a moment, where I want you to just kind of tell us in a line, where do you see the future of VR and AR? But before that, I just want to let all the attendees know, and those that listen back, that we will, Reach and its partners will be at HIMSS 21 in August 9th and to the 3rd, August 9th to 13th in the bright lights of Las Vegas. Hopefully all going well. So yeah, HIMSS 21 is happening. Please do register. Reach Live and its partners will be there, and those who are part of Behavior VR too will be there. And then the final word over to you, Rob. Where is the future of VR AR?
Because the availability of this technology is expanding so rapidly and the cost is lowering, it really is available for a wider and wider swath of the population. Where I see the next version of this, the next generation, is when we can pair Hollywood quality production, meaning the type of Hollywood movies and shows that are able to really move us emotionally. You know, you think about something like The Art of Happiness, where you really connect with that character, or, you know, other things like Game of Thrones, where you really have an emotional pull behind the outcome. When we're able to combine Hollywood level, what I call Disney storytelling, with the medical applications in VR, and with the ultimate goal of helping people make better choices and you know, behave in a way that will improve their health, I think that's the next generation of VR and AR, which we're working towards, which we're getting there. You know, this is something that's right on the horizon.
It's exciting stuff. Thank you so much for taking out time and being with us today. Thank you to all of our attendees. Please do subscribe to Reach and Reach Live. And please do follow Rob and the fantastic work that he's doing. I mean, it's brilliant. Thank you. Thanks so much
for having me. I really appreciate it.